Beeri so ve mwalle lamso TV gan selen de gesin wuni ilamso TV de shigang shen de kleke winso de vi wir ve wir fon. Ikishikalan ki vesani kunis singonju fongon seju semo nso keri semo nyoy bu naune unambu miwo ji awa gesina wun wim song. Ya wiriban gesin wun se wim wir msong adun zanza i USA rengdeng mo beniku yenin wo mo lan. Yire za ngonjo Judith Kibuh fonyoy. Wiki jujung fe ya ngonjo.
Be ya feyi.
We yu jung fo kero kishikalan ki.
Awoni bong sa mo fado sen.
Yikagan kavan da gesin wuni abelo wa ko tiada ven min sam ven be mo gesin wun se wim song gesin sen se wun si kun gesin wun wim song e zada zambo mo fasin ven min sam wona nyari mewo wushan mewiram ram wo bara yong di mewo October the mewo mo wong loy wa save a she ribeki be mo aboyin fo yasi wo kumin winye wo win so yong jikin toke win veri lo sungin gona wuro mo ngonju ye mo kutan saki linke ma zan sho ai wa fi tiver di salo wa kemka kwa suisa jiza ye mo de wil bami wo sonolon sho sa de zelia kishikelan ve kishiji bo san wa tarale ya ji zesi sa de rusho se za wa fier nyara ngan se mo yi ko ni wira adza sinsi de boda zesika
Beeri feyi. Dress is the safe association, but the most important thing is the our core early, our core yasi wadre ke ake en. Ibo ke wadre very possible for fe yasi to cure. Now, just a different therapies is more surgery be. Surgery do jika ai do liwo do show theater e do shelving or shelving tokeving the area of tokeving gedren show. E shelving ye show in reconstructive surgery after nin kun bombing bam la yo care the disease show. Another therapy chemotherapy before we allow for really the for destroy the cancer basically right down to the cellular level kifukesho ikilokin very strong and looking into sharia show now chemotherapy lower we will a lot of side effects so really lower care more nausea bay and vomiting I really allow chemotherapy but an effective treatment for breast cancer treatment mo the sa why for the radiation therapy why the laser highly radioactive treatment high energy radioactive rays for usually the cancer cells even agent affected or in the area affected a cancer cells ratio another therapy more therapy just show a little bit more conservative therapy but very effective also I yung hormone replacement therapy very far kifuki no allow no every other day kifuki show ikiloke wa regulate a hormone in really system especially cancer would more cancer will affecting the hormone receptors a hormone therapy low the most effective for cancer ratio allow me kifu every day and in a monitor or energy the cancer sa dulia kisa clearing mo kisa poi for ina and then they'll make a decision as a low opulent to either radiation therapy or chemotherapy or hormone therapy only but that's a very
ulim kijung
yes, William Kijum, very fair. Then another immunotherapy basically allow simulating your innate immune system for attacking the cancer cells. Sure. Now, depending on the kind of cancer we carry, then the kind of therapy, yeah, different, right? So a therapy is an limit for this cancer. And the greatest positive with the therapy to catch the cancer early. Fakekilo wa really allow most of the time the cancer doing already too far as they are at a very late stage. But I call the cancer at an early stage can be easy for treating.
Kintati ke won so ke America. Ver yen ven, ver juven, ver tin so bam ke folen idumaisi. Beeri. Ashunlia de Joseph season J se lambara kudu mais therapy. Gasmo si ayi koisa no kufu therapy. Akwa kiesi se wala asmo si se mo no ba koi boy for ya sifen. Feyi. Pomom Joseph se ma tangrin sininin ayong yiye ji cancer. Intoke winkin. Vage to men wi ya yong ji fe to vage to men wi wira nini ni fi the chemotherapy wa yong ve akuliga naro ve ji chemotherapy van ada ya nari robo kin vage so wani o ke kin to ke vin ayong ya lo fera una da una chemotherapy wuro so ila dia la shiyara ka alo yale.
So chemotherapy before a combination before allow wali 1, 2, 3 usually logan mosi wadro one kifuki mo on logan mosi wadro a combination of before of that we allow for very either through the IV most of the times, okay? Aligning why IV wiki one and four kifuke show and ala adrawa do either do the IV or adrali washu. Now the
I the ka
intravenous therapy alan drip malawa for
my way means we won't be
so we would yes I of the intravenous therapy so chemotherapy adralimo awa mia kifube or alimo awalia mawa ya minzowe we won't be are the routes for chemotherapy lodo nindu targeting the particular cancer cells we adren iwirhun nin destroy your cancer cells we show now the problem yes the problem will really allow care from the chemotherapy dojika a side effect more a cancer cells a lot more loki washa a cancer cells we show loki ni shati sa a cells we are healthy so really learn in a little bit more really learn in a little bit more sir, from the chemotherapy allow very very tired allow our care side effect more be allow our as a very sick just from the medications we very strong immune system so alodo I really do most of the time I do carry surgery or carry surgery I might surgery and in chemotherapy
surgery when the adwa win wira
Adwa when infer the cancer cell infer the lump. I young the lump. In toke vin ke shoke ki in that particular area alafer nin ke treatment or chemotherapy after the surgery for eradicating our cell cancer virgin on the other areas where are affected by your draft. Either that or I had just the chemotherapy when we on in reducing the cancer cell and reducing the tumor depending on how big or the Kentucky kidron. Bimokiloke wawi in different sizes. Wiramu ola wa keriki waje a small sheep, just shiwanji. Moki wiramu ola wa keraki as big as an orange, more orange big. Yes, so chemotherapy lows for reducing that size of the cancer, and allow reducing the size of the cancer. I'm all decide for you surgery, bo chemotherapy. I'm all decide for do directly into chemotherapy for reducing the size of the cancer. Both treatments work very well.
Beeri feyi. Malinga narikin beni we rotwen bama yoji aki yongji udrebe ya kintoke winkin kidran kesi kesi. Ad afer wuro fokidra kibor kidra keken ada dreyele ifi sin wona dreye ma yi fer wuro mo fokin nene shwa sita shanyam.
Yes, so Wira kon kintoke vingeki keke and care the greatest chance of survival. Be more, I call early be anenke immediate treatment as a treatment of cure at that point. Allow our care with the main goal for eradicating the cancer. Alan in most of the times, Shwahi Shavin at that point, be more I attack eliminating any potential opportunity for regrowth of the cancer cells. So aligning Shervin Yeshoi nin radiation therapy, nin shawana laser for usually our cells where you all for nashwa basically aligning the radiation therapy showed you allow that we could just see chemotherapy if possible or hormone replacement therapy, depending on the kind of surgery or the kind of cancer discovered. So, early stage breast cancer is one of the greatest and the best places to discover cancer. Be more the greatest chances of the greatest chances of the cure exist in that stage.
Zaya nari jo tambo nyari dramum fer. Alo fe nyar wa djo.
Nyari Wadra show, of course, but very controlled. From a personal level, care further mama already done through this. When I read getting Savia done through their caring Kintoke Vini the treatment and that's a very fine line. Yes, Nyari show especially I'd say and say a surgery involved and say a shan when I try it when if everything not only physical pain, emotional pain, also psychological pain. Who imagine wa care kifaki one in do shake walking in young walo or an artificial hand, he care a lot of psychological impacts so really, but um the good thing about it is you can support, right? Lila wa care a lot of support. A period where care for or kiwiro or joy yasiven for one positive encouragement, the very, very paramount for one recovery. Yes, yes, yes. A lot of support. A lot.
Lo do wuro mo vo wo kansa wo so kintoke winkin kinane ne wun feri wa de zeyele iyo zana mo ye kansa ben ze borben.
Mm. I yonke shoji really low show metastatic cancer. Metastatic cancer low stage 4 cancer higher. Iminijika cancer osho ilo anilen hoving in doer. We more iwo liver maybe or iwo liver or iwo lungs or something like that. Iwo ni wokitu. At that point, your kundradre cure at that point. The goal of treatment at that point, so yeah, just to controlling the disease at that point, mean for a little bit of prolonged life, decent life, pain-free life. So our treatment here more on symptomatic treatments. So adja wakera kituke buminkian and for kifufo kituke buminkila yo adja kera kituke buminki, but your adja for that cancer at that point. Akadja kera dra problem una vum ye bai ni anin for kifuke ke ye la vum ye yo abai wadro uncomfortable all the time. Lodra at that point, most of the time, man in Yongjawa lema or in the palliative care, just so that our wadra comfortable.
Kintati ke won so ke America. Ver yen ven, ver juven, ver tin so bam ke folen idumaisi. Tilo da fo wuro mo Nyùy san wona fer toka winkin ki bonin bo alo dzadza mo lebe mo bara ayong.
Yeah. Kake we your Nyùy. We're more Nyùy, right? So we in una breast cancer for as long as over 5 years is 90% chance warfarin one, a 90 to 99% chance according to the American Cancer Society or FEN, the statistics that we are carrying early detected breast cancer, we are treating only carry a high survival rate of over 5 years. Now, 5 years, the vaki we're young in, right? I don't know, just say 20 more years education la we are another problem. Now, unfortunately, Lord Regansi Mosi are our care a relapse meningical cancer also work we in affect maybe the other side or another area. I had occasionally and in care afresh in that care or jikisa we are hoping in care the treatment all over.
Nzen de sonyo kwa sham nzen mebiki ta ka be mo akati fo yasifen. Ma lon ji akutira wi wo mo usha inke yeji kwe ye mo bia yong ji metastatic metastatic cancer metastatic cancer. We yong he show limi ko sim wi fe. Beri wi o sininke yeshon ada wa tirwun jika yeji wani auzo wosi a tirwun mo wuro mo udan ngo we da fiya kinyo.
For making sure the awadra I follow the treatment program or phone. No matter the treatment program, I follow a treatment program very phone, a doctor's appointments. Sometimes very possible or very easy, but kids are very important for making sure yen any new thing I discover kifake kiyo yen kifake iwo wona kiyo order for yoni ake more reporti yen you kifake mo kiwo wona kiyo ko yoni ake mo yoni wo doctor after aninke just afelia the goal for treatment for that stage 4 mostly to keep you comfortable and keep you pain free so la nyari yo adresho Kenya rawa yong nyari wadra awafo kifua wano la Kenya akesa support really wadra wogang adzo wogang encourage wasabi moki odren ili kwadra imom ya mo wiye show idren shobe yes kuna bundri ayo yi license Nyùy ayo yi for Nyùy for equation also Nyùy yi the number 1 then Nyùy is a doctor una really una phobia no for get really yeah.
Agan se shoy agan se wuro bunde Nyùy lo bunde una su ru feye bi fo kinji gan fenlen akoda sa Nyùy won gan se mosi Nyùy ma ti ki kwa wo du make link fo fe ayo ko yong je wir wa maya fo atar won ba iki du make link fen ba wa yen agin sina da ki sifo bo awa fo da bonin fo Nyùy ngangang gan se mosi Nyùy din rom fo un mom rom benje ayen mo alo kulati it's anyar layo anyaro nganga Beeri also kusila tuna dumogan si yo zasinin de ben ka ayen mo ke zan wera mo da bayi kiji ya siban da bana wiya wuriya ninin ibo da ali iwa da fo wonshi urmolo da wiya ya kin kidraki ake en lawo ali shi akule fo ka ayemo ben we bara ka ayine kilin fo fe ben yenji kuku onda wiki biya ko kinyukin ya siban mo azza shara kufi sin wona wi yabe bi shanwi ya nini ne sanna sonnan mo afafana
Anini ni rasholen be more
mm
really lawa their own breast self examinations nin kun yenji kifake mo ki mju kifafe na ki or defend ki yake ki shan or ki or
mm
defend 6 months ago, you know, or in wese si shan so kinyo ki defend am king mo du yen doctor ai lo du lo le nenje na kin toke so
mm
early detection here really a number see increase a lot and the cure of it to increase it over the years. We didn't know sure I need. Kid a very important JVK, no matter the age, a lot from a childbearing age at least. Our breast self-examination. I'm why young breast self-examination. La like
yala
okay.
angewin men
Anevin and yes, go kitoke ala yi show at angelvin ya kemo ki kitoke kimo vincent ko akimo a konto sidran show yes. Alo you kifafwani na sweet doctor J. Doctor, molo convenium yoni or the other day nin kum kifafe na mo kibisaraka nta a testi amwa yibe.
Beeri wo fe beeri ben be mala wa fo saka bani ki wa muri anini ne yam na so ada sareng reng mo be feri wai ningang ye ja wa ku wa fe ke kujika anini ne ku an fen cha mo be ku mo ayo afat fasina
Um, Anini nidropusa, anini nidropu, but I opu from a direct relation to the breast cancer. Yeah, more
mm
from metastatic,
mm
more related to ako breast cancer. Osha uduni nindusha sin mom young is stage 4B.
mm
Um, and Apple, but their incidence is much more reduced, be more core early then. So since 1989, but according to American Cancer Association, often uh,
mm
we report reducing it by about 42%, which is a great increase.
mm
And the survival rate increasing it by 90%. So at least I end the big discrepancy. Really surviving more than Apple like back in the day, be
mm
more because I discover refurbished.
nso ko yi jikin toke win kinad fo yasgo usi ko yi be san fongu abe la yen mo wini ton we yi twice yen ne ba ki jikida yasi gansi mo singa yi ke na de be ayo ngef sa fo ayu jik fakisa de shwa ad wo mo win so wir fon fo ma mo ye ni shi fe bara ananin ben ada wa fuji bifu be shi ven so mo be de ba ti benji ik fam wi so famin uboy fa yasi na
Before we shift, so we are more of a palliative than curative. Mbota
mm
mjo science ki much of traditional medicine and traditional healing. Ayo odrem young sadly before we move into savvy adre we me or we live before we so ila yo walim. Your drum young sad
mm
baby mom walking the science behind Adam Young Adam Fabian Keen, right? But before we send
mm
we more of the address recently more adre with na full love it be kiso
mm
unanyari, for example, or unagifaka yonji inflammation.
mm
And the show this for reducing the impact of the disease, but not to cure,
mm
not for curing. Adajawata usually the cancer akemo duli bukeshi ke bara
ke bara ka aine ke jojo
ke bara ka anyi. Yeah.
jati ke won so ke Amerika ver yen ven ver juven ver tin so bam ke folen idumaisi Beeri wonantira osolara unfo fo ishara kumi mkiya za wir imam ke sa'atin ke BFU USA amo nsatigala mum wadanta she jilo ba alon fi tia jimkiya jaza wir ke sa'atin wofo im yoji kisar ke BFU bui family union feye kisa ker party ki gifage mo kisilimi fo savi ki yadzan imam kinyofena kinafo king sinsa famo wana kishwa
Yes,
BFU yeah.
BFU. Yes, BFU USA Care, a program for la IOMG Access, a program also idoka allow ali doctors, atrensia doctors, via your care, the ability for the hospital. A screening, a health screening, one of the screenings where you the breast cancer screening. So mo be done recently for the breast cancer screening or show the kiamo on either two or there kiaba care breast cancer mention see do show hospital I do treat only. So yes, BFU USA care party for really wanna be having V and a doctor Viala wadu for screening vesho ni lawa for santir for education ni one le wiki vya yiwi unavya joyi awa dua hospital or awa ya breast self examination unavi farin for making sure je ayo wa mati ya vifauni unayo kivifavi odren vifavi dren awa le ya vifavi dren naoni vinci ninjena doctor for report ya vifavi show ya doa hospital show la ashiji wa hijo ya jo yinba doa hospital ifen ve care modern October shan a different chapter see yi participating in a local breast cancer awareness program. See, I do more. I do ye match a match. I'm all ye do involve with to na community outreach for ye breast cancer education. I ye AVK. I'm all community my ye breast self examinations. So very killing of veteran at the moms are for spreading the word on breast cancer it can talk even really more veteran hola una really veteran fence
aben yibe yenji puye shone fasa fola fasin mo iyo ni afar wunye puye kume yasikin toke winu
no the statistics veteran follow ayo the very clear more research or more yenin but from follow a statistics and more able for yen from follow other G yes it was shown Joe Wiki listen at a very high rate. This is from 2010, 2011 statistics or more yenin. Wiki listen you are pull from Kito Kevin be your ye early detection. I mostly I am yena I could do need too much to the point where your reality. So unfortunately, the center carry a long way to go. A lot of sensitization and important. Listen for Yibiki, listen, you are very aware. Alisa very seriously, especially from the age of 40. Allow me 40 and that's very important. Yeah, your mammogram just for making sure you are driving.
eke bi me fe ji BFU USA wa yi funina gitawin isara ni me wiki yadam win solo wa ki ko yasia gan se mo unere ne won kipo lo de dia wa ki atara ke nywa drak bor wirang mai be shoy lo yu uni ko wonjo wa na kwa de ku ya no ji jikira awuna ke bongja wa duta ikiya ji sa kemka yo de tu ka bu men gedem ka da kwa nji ki wi abam kinja ki wi ya wa bong ya wa kuta kan si mo silo mena yi sa ketan wilom kwa fanyi undua ke ya tara nadra damba un sai la sai ka ke bo la ka kwa ke bong ya wa king sinya sha fo ya fe ya si mo wen so ma an gan Beeri feyi ngonjo ibo Judith fanyi adam yong ilam soji yong nam soji Judith
Amo yao mi yung mo be.
Beeri osodo lo kon bam ke so ki imma ke bam ki kum kinyu ke so ke tisho ki linke BFU veyi yam sungni na de vera ta sa o BFU wollen wodan re banapti agan se bam se vera ne sungnin wula suiveji zam ye BFU ye moze la wiwin ayo ni shu akara ke mai zam so yo kiyo ji ke fan se melen we ya jing ya yuaji BFU sa suini ya wi zam adafia.
Yes, Bekeri ni kere ke I'm sure next year I had rather North Carolina, Charlotte. We had rather Charlotte in North Carolina.
Eh, de ke fola yong Charlotte da yi wir mo even yong kana yi da. Be ya sai da wannan ke so ki ibe yoji ad fola aka inside so.
The one ojem.
Ojem.
One ojem Kimbo.
Beeri anjem shiwo ye jiga fagi fera o feki da vamshinan mo bella kuna vamshinan bo tumpasa idzara ya wa shukiji kifaki ada wa simi fo yi kidaka ka da fe be simi fe
Ban wuna kiwar ka kangin ki wuna mingve me ba mi ashiki. Shingmang. That's it.
nyamo ya da bena daga ban ke dan kisam ke gaban
Kicking back.
nyamo ku me gan se so wi li ga bandu si ga wa so si enjo na si ana ba so
Unashibashi, just a little bit. That's it.
Beeri wo feye ngonju judir fonyoy am place je da fonyoy won fonyoy ma wi shem sin lanki
Very well, chef.
mai sa she ayya be mai she ya mangong mai she fonda basa basan sila mar lanki akong ngeda ker boso ku jara si za yi be gansi seke fesi dunidi de mai igansi
Very well, Faye. Very well.
Beeri imma sheri so jam wir fon jam wo mo okile Yesin wuni kan selen ake zavera ngonju kibo Judith fonyoy wadansa yadom o limila shi America au zavera one fo fer if ti za se fer se ma fer yasu bara yon di cancer of the breast wadan Kentucky win o win so yongi loni de dinyo wa ku sa iki tirwir inda fasa ukuyu ya jumle taka amom fo tar anye wunwa fo ki ake za ke bor gan samo si ibara sawun fo fer iba sana ber gan samo si